Alrighty, and then
Hi.
Tori, if you're there, start to unmute.
Hi, can everyone hear me okay?
Yep.
Great. Hi, flex coordinators and our stakeholders. This is Tori Leach, your federal program coordinator for the Medicare Rural Hospital Flexibility Program. I'm joined by my colleague Natalia Vargas, who is your MBQIP coordinator, and we're going to go over your NCC instructions and provide you with an update. This is our agenda for today. We're going to start with an MBQIP update from Natalia. I'll be providing some background on the NCC. I'll be going into detail on the progress report instructions, your upcoming reporting requirements, your technical assistance resources I used you go through this process, and then we'll address any questions that you have. Now I'll turn it over to Natalia to provide us an update.
It'll be star 2 to unmute, Natalia.
Hi, can everyone hear me okay?
Yep.
Great. Thanks everyone, and thank you, Tori. My name is Natalia Vargas, and as many of you know already, I'm the new MBQIP program coordinator for our office. And today I just want to go back to the basics a little bit just to set the stage and really look at MBQIP in terms of the purpose and how it links all back to Flex. And I know that many of you have been with us in some way or another for a very long time, and this overview may seem very basic, but at the same time I think it is sometimes helpful just to kind of remember why we're doing the work that we're doing for MBQIP. And really the purpose of the program is to enable the critical access hospitals to demonstrate improvements in the quality of care that they're providing to their patients. And as you can remember, there is 4 key quality measurement areas that include care transitions, outpatient care, patient engagement, patient safety, and inpatient. And so in doing the work that we plan to do for Flex in the coming year, I really want to point your attention to the objectives. And 3 main objectives which all relate to increasing quality data reporting, but also measure outcomes and kind of comparing that, having a comparison point at a national level to see how the critical access hospitals are performing and how we can support their quality improvement efforts. And so overall, we hope to improve the health outcomes and also to encourage the highest level of care to each of the patients that are served by the critical access hospital. For this NCC, I think is a brand new opportunity to really take that glass half full approach and find out, what are the weak areas of MBQIP reporting or performance, and refine your strategy for QI as you look into the following year. So Tori will be going over a little bit later in the presentation and talk about ways that you can address challenges in your narrative, and I think that would be a perfect opportunity to make those linkages and really let us know what's working, what's not working for your MBQIP program. And this is just a great door for us to really get to come in and understand with you what are the issues that are most pertinent to your communities. And so I wanted to encourage everyone to really look at it from this lens and considering that these are the aims that we will continue to look for in FY20. So if we go to the next slide, in terms of MBQIP eligibility, I'll talk to you a little bit about this. We're making some changes. So for this year, I wanted to announce that we're suspending the eligibility requirements, And this is due to a number of factors. But before we go there, let's just go over real quickly and cover the items on this slide just to refresh our minds about the eligibility for, and how we calculate that at Forhp. The critical access hospitals must meet 3 MBQIP reporting criteria to be eligible to receive flex funds to support their activities. So the first one is do we have a signed MOU to submit and share the MBQIP data? So without that, we can't really use the data, and therefore it's extremely important that each of you in your own capacity can really push forward for having signed MOU. Secondly, the reported data on at least one MBQIP measure for at least 2 quarters in at least 3 of the 4 key quality measurement areas within a certain reporting period. So again, going back to the previous slide in that graphic, can you look at least one MBQIP core measure in those areas and reported consecutively for 2 quarters? And then finally, can you demonstrate, can CAS demonstrate, the appropriate notices of participation for public reporting, and also opt to not suppress the data so that we can actually use that data, and even better if you can encourage them to publicly report the data so that we can also have it available that route. So for measures that are only reported on an annual basis, such as the OP22, they count towards the requirement of reporting for at least 2 quarters. And then just wanted to point out that due to variations in data availability and timing, the reporting period for EDTC is different than the other measures. And again, going back to what I mentioned in the beginning, for this particular year, we are not going to be assessing the eligibility. We understand that many of you have had challenges in the time period leading up to the full-blown pandemic situation that we're currently facing. At the same time, we have had a number, excuse me, a number of staff transitions in terms of POs. We've been getting those emails over the course of the past few months, and we recognize that all of this provides certain challenges that may give you somewhat of a disadvantage. If you are on the high-performing side, I think you don't have to worry about that. We'll still consider the data, of course, and appreciate the efforts to continue to provide the data to us. But this is definitely one exception that we're making. We're not planning to suspend this MBQIP eligibility requirements altogether. It's just for this year, given the emergency situation that we're facing together at a national level. So for the MBQIP eligibility in 2020, we continue to encourage the reporting of as many measures as possible, regardless of what the minimum requirements are. And this remains whether it is for this year or future years. I think it is very important that we encourage the public reporting. That is how we can assess outcomes at a national level in a way that makes our program show impact in comparison to other hospitals. And sometimes it is the case that in some measures our performance with critical access hospitals is better or very similar to the urban hospitals. So we just wanted to make sure that everyone continues to push that forward regardless of these limitations that we have this year. I think we want to maintain the momentum that many of you have been showing in making really good progress in your quality improvement work. And ultimately, we just want to use the measures in a very pragmatic way to improve quality of care and to find ways and identify different strategies to improve care. So some of the key changes that I wanted to point out to you for FY 2020 in terms of measures, just wanted to call your attention to the EDTC measure. Many of you have participated in the past webinars that were offered by the ARKITA team on the EDTC measure changes and the specifications that were released on their website. So I encourage you to go back and go back to your notes and also go back to the website just to make sure that we're all on the same page. You can also send us questions, of course, at any time, or reach out to the ARKITA team as well. They'll always welcome your input and questions. In terms of the antibiotic stewardship measure, we will use the 2019, the calendar year 2019 data for the survey moving forward, and then any changes in the future, of course, will disseminate broadly. In terms of requirements, we always try to align with CMS measurement policies, and that sometimes is not very, it's not a very straight line. So we just want to acknowledge that and just let you know that context so that you know that at all times we're really trying to work in collaboration with our federal partner, and we make decisions based on what are the priorities at the national level, both for CMS and the directives we get at our agency level in HHS. We aim to align, but also we recognize the need for rural relevant measures, and we hope that in the coming year we will make good progress in really thinking through other kind of measures that could fit the program and meet the need in a better capacity than the measures that we've considered as the core measures so far. I hope that many of you can join us in the MBQuip session that we will have at the Riverside visit, in which we will have an opportunity to really brainstorm those ideas a little bit more. So in terms of the MBQuip waiver and what that means for this coming year, we will not have a waiver, of course, based on what I just mentioned about the eligibility exception for 2020. Any potential waivers that may be needed in the future as we really consider how to move forward after the pandemic situation would require the compliance with the normal process, which is really specified in the NCC attachment number 5. But I would encourage all of you to consult with our office, with your PO, and with me about challenges that you're facing with measure reporting as you're thinking about filing for a waiver. So we would like to really hear about that, possibly in the narrative. In part 3, there is a spot there that fits really well to just provide that additional context for us, so we can anticipate ways and strategies to have those available for help depending on the issue that you're facing. And then secondly, we want to make sure that you're aware, many of you are, but just wanted to reiterate that ARKITA and Tasc provide excellent technical assistance and resources and opportunities for enhanced TI. So really, we want to encourage folks to reach out to them and to take that initiative to really recognize what are the weaknesses and how can we help you succeed. The idea is that this MBQuip requirements and eligibility and all of these things are not supposed to be super stressful, but we really want everyone to really think about the why. Why are we measuring? And we can't improve what we can't measure. So ultimately, we really put the onus on you to reach out when you have an issue that we cannot see from our PO lens or from the TA provider lens. we'll do the best we can, but as always, we are very willing to work with you one-on-one and to really look at cases on an individual basis. We understand that measurement issues are different across the states, and all of you have a lot of complementary strengths, but also have areas that you can improve. And so we look forward to partnering with you and doing that and really thinking about that. So in terms of this NCC, just really focusing on that narrative, the part 3. So again, just wanted to go over really quickly on what the requirements would be for those of you who are new or just came to understand a little bit more about the MBQIP program. We have certain requirements that need to be met in order to make sure that you have a waiver in place that will not be detrimental to you receiving any flex funding for activities in your grants related to quality. So first is the Critical Access Hospital NCC, I'm sorry, and the name of the hospital that is requiring that waiver, and we will need one in place if, for example, they face the same issue in 2 consecutive quarters. We will need a new one each time, so just keep that in mind. We also would like to have a copy of the MOU and the justification and the NOP, or the Notice of Participation for public reporting, just to make sure that they're choosing not to suppress the data. And also in terms of making sure that we have all in one package with signatures and dates. If you can send it to our office, addressing the Tori as our flex coordinator here in the office, but also depending on whether you have a specific PO, always make sure that your PO is also aware. And then, of course, we will need the support of your flex coordinator at the state level and the Critical Access Hospital representative. And based on that, we will look at the justification. Just having that paperwork does not mean that automatically it would translate into a hospital being approved, but we will evaluate again based on different factors. And so I just wanted to make sure that everyone is aware of the justification piece, which is really important to help us understand the context. So for the overall performance this year that we were able to capture, I think so far we're doing extremely well. We have a number of hospitals, 1339 hospitals that have signed the MOU, and that demonstrates a strong commitment to MBQIP, which is great. We have 93% of critical access hospitals that reported quality measures in at least 3 domains in the past year, which is about a 5% increase from the FY18. And the percent of critical access hospitals reporting inpatient measures increased from 89.2% in 2017 to 92.9% in 2018. So that trend continues to increase, and we're very happy to see that growth. The percent of critical access hospitals that are reporting outpatient measures also increased dramatically from 65% to about 87% in the year 2018. Just reminding you that this is based on data that our FMT team acquired and studied at a national level. So we have 19 states overall that had all of their critical access hospitals that were reporting inpatient measures, and 13 states that had all of their critical access hospitals reporting on the outpatient measures. So definitely this is an area of improvement, but we're very happy to see the engagement, and we hope to continue to see that in the future. So with that, I wanted to just very quickly go over some of the data that we have at a national level for comparison purposes, and really look at a baseline of those CAS who are reporting to Hospital Compare and what are some areas of improvement. So based on that data, we wanted to make sure that we call out on these measures that are a little bit on the low, on the, as you can see on the right side, measures that we can improve reporting on collectively. And the goal overall is to really just encourage critical access hospitals to report publicly, so that we have more of a correct picture at a national level of all of the critical access hospitals and how they perform against one another on the different quality areas. Lastly, I just wanted to make sure that I offer my assistance if you need to answer any questions. I know that there is a lot coming to you in the most recent days with this pandemic effort, but hopefully you all have received an email with further guidance regarding our flexibilities with MBQIP in the next 2 quarters of reporting, so that should alleviate some of that stress. If you have any questions about that email after you had a chance to read through it, just feel free to reach out to us. We're always happy to help. And with that, I'll turn it over to Tori to provide a little bit of background.
Thanks so much, Natalia. And Natalia will be here for the end of the presentation as well when we'll accept questions. So just to give some background on this year's NCC, FY 2020 is the second year of your 5-year project period. The instructions were released on Friday, and they're due back to HRSA on May 15th. The progress report serves as the basis for continued funding and a streamline of the review process. So the purpose of the progress report is to give a summary of activities that you've completed thus far in your year and what your plan is for the future year, which is FY 20. It's also an opportunity to give us an update, to readjust your work plan items if you see fit, and to refine your FLEX project ideas. So this is where we are in the FLEX timeline. As you can see, we're about 8 months into year 1, which is FY 19, and we've just hit our NCC reporting timeline. Year 2 starts on September 1st, and that will be the basis for your future year reporting. So there are some major changes with this year's NCC. In the past, you've had NCCs that are about 15 pages long, that included the progress, activities completed, your current year plans, your future year plans, your significant changes, challenges, and barriers, opportunities for the FLEX program improvements, lessons learned, best practices, and recommendations for the FLEX program in general. This year, I've cut it back to 10 pages maximum. You're going to report out on your current year progress and your planned activities for your current year, your future year plans, any significant changes, challenges, and barriers. We've added a new item, which is significant accomplishment, and for those of you who are involved in your SOAR grants, that is very similar. We are using it as an opportunity if we have a request for information for what's going on with the FLEX program in Arizona. We want to quickly be able to go and pull out something significant that you all have found and be able to share that with those stakeholders. And then we're keeping the optional recommendation for FLEX program. So this is an overview of what is required of you with your NCC. Your performance narrative, which is 10 pages maximum. You have a budget justification for your future year, which is FY 2020. We are asking you to do a work plan template update. This is not going to be asking you to do any data input into that work plan template. I only want to see changes that you submitted from your competitive year. Please include position descriptions and bio sketches of new staff. As Natalia mentioned, we will not be requiring MBQIP participation waivers this year. So please, if you have downloaded your instructions from EHB, this is a new addition. So please go by these instructions. For those of you who are EMS supplements awardees. You will have to do a progress report that will be 5 pages long. You will have to do a budget justification, and you will also do a work plan template update for any changes. So your performance narrative is no more than 10 pages, no smaller than 1-inch margins, and a rateable 12-point font. It can be single or double spaced. The format should be in PDF doc or docx, and everything needs to be uploaded into EHB. So the contents of the performance narrative include your current year, FY19, progress and planned activities. In that, we expect to see the number of cost site visits completed since the beginning of your project year, and the number that are planned before the end of the project year. We completely understand that this number may be very different from what you initially anticipated due to the COVID-19 outbreak. We then expect to see your future year planned activities and the number of CODs that are planned to be completed. Natalia mentioned the significant changes, challenges, and barriers section. This should be an opportunity to assess any TA needs that you need and any challenges with any of your FLEX activities. A significant accomplishment, this is described as one thing from your FLEX program that should be representative of what you do. And then you have the option to provide recommendations for improving the FLEX program. As a reminder, all of your activities must fit within the competitive instructions. I have linked it here. Please consult your project officer if you're unsure where an activity may fit. As a reminder, here are the 6 areas of the FLEX program: CAW quality improvements, CAW operational and financial improvements, population health improvements, rural EMS, innovative model development, and CAW designation. Significant changes in the objectives, aims, or purposes must be discussed with your project officer. Budget changes. We are completely aware that there may be some significant upheaval in your budgets due to the COVID-19 outbreak. We are going to be extremely flexible as long as you talk to us about it. So please discuss with your project officer if you're making any major changes. And as a reminder, you are able to make up to 25% of your total budget changes without official HRSA approval. However, we recommend that you discuss any budget change with your project officer. The details of the cost must be within each of the budget categories that are found in the SF424A form. All personnel costs must be outlined. Travel must be outlined as well, and contracts with the clear explanation of the deliverables. This is a reminder of specific budget requirements as it pertains to this program. Recipients should have all of the budget levels in the NCC guidance, so please refer to the guidance to your total budget for the year. You must have at least one full-time equivalent FTE position dedicated to the FLEX program. All recipients must participate in the 2020 National FLEX meeting, reverse site visit, and one other regional or national meeting each year. FLEX representatives are encouraged to attend the NRHA CAW conference in Kansas City, Missouri. And new personnel are required to attend the FLEX program workshop in Duluth, Minnesota within 1 year of start date in the role. However, this year, we completely understand if you were unable to attend the canceled site visit that was held in April, that should have been held late March. There hopefully will be one in October, and we are waiving this requirement this year. However, all new FLEX personnel are expected to attend a new FLEX workshop orientation at some point in the near future, as that is allowable. The FLEX program has an indirect cost cap of 15%. This limit comes to approximately 13.04% of the total program award, inclusive of direct and indirect costs. As a reminder, subrecipients and recipients of this award may not use FLEX funds for the following purposes: for direct patient care, to purchase ambulances and other vehicles, to purchase or improve real property, and for any purposes which are inconsistent with the language of the Notice of Funding Opportunity for this program. As a reminder for attachments, each document should include the grant number, project title, organization name, and primary contact name. You should only attach the components listed in the instructions, and submissions will be returned if they are insufficient or missing information. Please start all file names with your state abbreviation, for example, below. Use informative file names, and please do not scan documents as images. We need to search these documents through the computer. So your first attachment will be the update to the work plan template. Please use the work plan template update to update any current year activities in FY 2019. If a new activity has been introduced or an activity has been terminated, you should clearly identify that. The updated work plan should not include quantitative output data, and that should be waited until the end of your report to update those measures. For future year, please include any ongoing activities that will continue from the current budget period, as well as any changes that you have made. The attachment 2 should include any position of a new staff or a new staff member that has joined your team, or there's a vacancy that is currently in your staff. Please include a bio sketch or resume for all new staff. If there were no changes since March of 2019 when your competitive application was submitted, please include a no staff changes sentence. As previously mentioned, attachment 3, the ambiguous waiver participations are not required this year. And as a reminder, this is a 1-year suspension. And all critical access hospitals are eligible to participate in flex-funded activities for FY 2020. For those of you who are EMS supplement awardees, please include a progress report that will go over any activities you completed in your FY19 year and any significant changes, challenges, or barriers that you faced in FY19. This should be no more than 5 pages in length. We're asking you to include a budget justification for your EMS supplement. Its purpose is to provide a clear overview of your proposed spending for the program-funded project for your future year. All travel and contractual costs must be itemized, and contractual costs should also include deliverables. We are also asking the EMS supplement awardees to provide a work plan template update for your current year for any changes that you have made to your work plan, and for the future year FY 2020 for anything that has changed or is ongoing. Again, please do not include any qualitative output based on process measures. This will be asked of you in the end of your report. So for reporting requirements, you have your annual federal financial report on January 30th, 2021. Your PIMS reports, your Performance Improvement and Measurement System, will be due on October 31st. A new addition this year is the end of year report, which will be due 90 days after the budget period ends, which is November 30th. And then we anticipate your next non-competing continuation progress report to come out in March of 2021. So over the next few months, Forhp will be working with you to develop a template for this end of year report. You will be asked to update your work plan template for your FY19 for all completed activities and the summary 5-year tabs of the work plan template. This will help us capture a full year of data and accomplishments and minimize the burden of NCC reporting. We will be providing webinars, additional education, and support for this report. So just to compare what is asked of you in your NCC versus what will be asked of you in the end of year report, you can see that the end of year report is only 5 pages, so significantly shorter, and will focus on completed activity accomplishments and flex program improvement areas and lessons learned. The focus will be on inputting data into your work plan template to show a full year of results, and an opportunity for the EMS supplement to look back at a full year of accomplishments as well. We have a lot of technical assistance resources to support you all in this process. We have the HRSA EHB Handbook. We have the HRSA Contact Center, your project officer, Tasc, Arkita, the Flex Forum, and great guidance and templates. As a reminder of who your project officer is, all those in light blue and dark blue are my grantees, and then the yellow and red are Natalia's. Now we'll take any questions that you have. Maybe this one is best for Natalia. Natalia, Jennifer Finley asked, has the EDTC revised spreadsheet been sent to the states yet?
Hi, I'm so sorry, I was on mute. The revised specifications are posted on the Arkita website, and we can send a link after this webinar broadly just to make sure that everyone has that. And I think that does that answer your question, or
The question was around the EDTC revised spreadsheet.
Oh yes, in terms of the spreadsheet, yes, we have been working with our contractor to make the last changes on that, and we will be sending that along with the other updates that I'll be sending today. So just watch out for more emails, and unfortunately we just had a flood of emails regarding the coronavirus response. But that is a good point, and I think that we will welcome definitely questions after you receive the emails at the end of the day today. So a lot of you also probably had not had a chance to review the email that I sent just prior to this webinar too. So I'm happy to take any questions after probably starting tomorrow to give you some time to look over that information.
Thank you, Natalia. Aaliyah asked, if our state has not lifted travel restrictions by the time the reverse site visit happens, will this requirement be waived? And my answer to you and for everyone on the call is yes. If your state is imposing restrictions on your travel, we will of course abide by those restrictions, and there will not be penalties for not attending a meeting that your state has unallowed you to attend. Misty Dennis asked, for grant year 2020, we are no longer on quarterly reporting requirements. Is that correct? Quarterly reports are individual, so that is a decision made for each of the FLEX programs, whether you are on or not quarterly reporting. So you will be notified with the release of your notice of award if you are on quarterly reporting or not. Okay, Lindsay in Washington asked, in the world of COVID-19, we are considering setting up some Zoom meetings with our cost staff in replacements of our site visits later this spring. Can we count those as site visits? My response is yes, you can absolutely count those as site visits. We are pushing that you do continue your work plan activities in any means that you are able to. And if that means creating a virtual visit in replace of an actual visit, we are absolutely supportive of those counting as a site visit for you all. Ronnie from Massachusetts asked if the reverse site visit is likely to be virtual. And unfortunately, Ronnie, we just don't know at this point in time. We will certainly keep you as up to date as possible on the decisions around in-person meetings in the future. Renee asked, do we know about this year's funding being extended? So because we are in the middle of a 5-year project cycle, there is a great opportunity to use the carryover process to move funds from this year into next year if you're unable to complete activities this year. So extended will just be a carryover because you're in the middle of a larger project period. Do we have any other questions? Robert asked if the entity has already, oh, go ahead.
I do have a question. So if we if we applied for and received unexpended funds from last year's grant and we're not able to complete some of those due to the coronavirus, are those funds then just going to be gone?
Hi, is this Jill?
Yeah.
Oh, hi, Jill. Yes, that is a conversation you should have with Natalia, your project officer. We're going to do anything that was on the H-54, the old awards, on a case-by-case basis. So please reach out to Natalia to have that discussion on those funds.
Sounds good. Thank you.
Thank you. Robert asked in the chat box, has the NCC already been released in EHB? Yes, Robert, it was released on Friday. If it is not showing up as a task in your queue, it is very possible that you have not added the new U2W award to your EHB profile. I can include some instructions in this chat box so that everyone can see the steps to follow in that process. Okay, Sarah in Oregon asked, the work plan template from Tasc includes actual outputs column, and this should be left blank when we submit the NCC. Correct. So the only thing that I'm looking for in the work plan template update are any changes to activities that you're doing. I do not expect to see any actual outputs in that column. We're going to save that for the end of your report so that we see a full year of outputs. Any other questions? Okay, Aaliyah asked, at what point do you anticipate making a final call about the reverse site visit? Right now, we don't have a date in mind to make those kind of calls. I think we're just waiting to see how the COVID-19 outbreak progresses. We will definitely circle back with you all as soon as we have a better idea of what that timeline may be. But thank you for your question. And Renee, I'm sorry that the video link won't open. I will try and resend it out to everyone after this call. And I'll also have Tasc included on the website just in case anyone is having additional difficulties. Thank you for letting me know. Cassie asked in the chat if there's a preferred format to include work plan updates. And Cassie, it is currently in an Excel file, so keeping it in an Excel file or the PDF version of that Excel would be the preferred format. Any additional questions at this time? Aaliyah asked in the chat box if we have any idea when the FMT financial data may be released. I am not sure off the top of my head, Aaliyah, but I can check with our interim FMT coordinator and get back to you on that. Misty asked if these slides are the same ones that are already posted on the Tasc website. Yes, they are. They were posted early. If you were going to start on the NCC early, that you would have these available as a resource. So these slides are the same that were currently posted on the Tasc website. All right, if there are no more questions, we will conclude this webinar. Thank you all so much for your continued efforts throughout the COVID-19 crisis. We at Forhp will continue to put out information in our weekly announcements, so please make sure that you are on that listserv and are receiving those announcements. We will also be sending information through the Flex Coordinators listserv as it pertains to critical access hospitals and the Flex program. We are hopeful to be able to provide you additional information as it relates to the new funding bill that was just passed very soon as we're able to share guidance with that. And then in the rural route that was released just this morning, there is a link to the HRSA FAQ on COVID-19 related questions. So please use that as a resource as well. Thank you so much and have a lovely week.